my name is Laura Steele. I'm happy to be here. I'm a program officer with the Episcopal Relief and Development based in Denver. Today, I'll primarily be watching the chat and helping to facilitate behind the scenes.
Reverend Canon Michael Bamberger.
I'm Michael Bamberger. I'm a parish priest just outside of Los Angeles. I also serve the larger church as a member of the General Board of Examining Chaplains. And for Episcopal Relief and Development, I'm one of the partners in response and resilience, and have been doing that for about 9 years.
Hi, everyone. My name is Renée Coleman-Mitchell. I'm a former commissioner for the Connecticut Department of Public Health. I was invited by my friend and colleague, Dr. Cathy Slemp, to participate. I've met these lovely participants the other day, and I am extremely excited to bring a perspective about public health in a Christian way, in which my background, I haven't been pretty much allowed to do such with the separation of church and state. So I'm very excited to be here.
And I'm Dr. Cathy Slemp. I am here in the Diocese of West Virginia and started out as a family practice physician, and then in the last 20 years have spent my career in public health as well. Emergency preparedness, disaster response, infectious disease, outbreak investigation, et cetera. And then most recently served as our state health officer and commissioner in West Virginia, where I got to know Renee and so many other colleagues around the country that are doing a remarkable job. I also get the honor of serving in resiliency and recovery for Episcopal Relief and Development. So it's wonderful to bridge worlds here today and be with you. Thank you.
Thank you so much, Cathy. We're actually going to stay with you, and just so that folks know what Partners in Response and Resilience is these are folks that have been through disasters before, and they have figured out how to meander the process of being church in a disaster world, and can be guides on the side for those who have gone through that process in their own region. Cathy, we're going to start with you. What are your top 5 things you want? We're just going to dive into the COVID vaccine land. What do you want folks to know? What do we need to know? Let's talk about variants. Let's talk about it.
Sure. Well, vaccines are so exciting. I guess the first thing is just to really say that they truly are kind of a game-changing addition to our grouping of tools to move through this pandemic. And so, that is just the importance of the vaccine and its effect both for us individually as well as collectively as smaller communities and groups and churches and more broadly in society. So I think that first thing is just how game-changing these are. People can have a lot of questions around what kinds of vaccines are available now and are in the pipeline. And so that's the second area I guess I would touch briefly on. As you know, Moderna and Pfizer, which are both mRNA vaccines, are currently the ones available in the US, approved for use under this kind of initial platform under Operation Warp Speed. So we hear lots about those, but there are actually 4 different platforms with 2 vaccines each and others in the pipeline. So we are likely to next see some viral vector vaccines. You've heard about Janssen or Johnson & Johnson, and then the Oxford AstraZeneca vaccine will probably be the next ones that we will begin to have available here. And then we probably will move to the Novavax or the additional sort of adjuvanted vaccines, more traditional approaches to vaccination that we've seen. So each has their own strengths, and we can touch base on those if there are questions with that. We are clearly learning more about each of them every day, especially in the world of variants. So we can't fully compare data from one to another, but there's a lot that we can look at and know. What we do know is that so far, everyone that we've been testing really does make a significant difference and has the great potential to really get us back to a more normal operating practice as we move forward. The third area I would say, Tamara, that I get lots of questions around is safety. A lot of concern around the speed of development And I really have to say that, the scientific process was followed here, and that's what's so exciting. Where we got our efficiencies of speed was more in doing the production simultaneous to the development of the vaccine. And testing of the vaccine. So that's where our efficiencies came from. But the process in the US for developing vaccines and testing them really we're known for doing that well and to producing safe and effective vaccines, and then to follow them post-production to watch for any of those rare or unexpected safety issues. So there's really no reason to believe anything different with these rollouts. And so far, all of our post-production surveillance have been holding on to what we see in trials. Very, very occasional, a handful in a million doses, allergic reactions. There's been a little bit of a question potentially around low platelet counts. Very rare again, but not even clear that that is actually a vaccine effect yet or not. And so on the benefit side, we see them being remarkably effective, more than we ever imagined, actually, both in preventing disease, but especially in preventing kind of hospitalization and death and severe disease, and the big impacts of this pandemic. So, those are areas that they're really doing quite well in, and that we will continue to follow and monitor and watch. But they really have such potential and to make a big difference, and that benefit so outweighs any very small and expected risk. So that's the third area. And then you asked about variants. We do have variants coming out currently of the UK and South Africa and Brazil, but there will be others. We know that this is a normal part of viral replication. The more a virus replicates, the more little changes occur in its genetic makeup, and those get selected out. And so the key to preventing the new impacts of these variants when they are meaningful is getting down the replication of the virus. And so that's why it is so important not just to quickly get vaccine in place, but also to continue our efforts around masking and social distancing and ventilation, and all those other tools in our toolbox that we know make a real difference. So I guess that would be my final area to kind of speak to, is just to really say how important it is that we see vaccine as one tool in the toolbox. It can change things for us. I think once vaccinated, people can take a breath, reduce that anxiety. As my dad said after he got vaccinated, I may yet live through this pandemic. We're more comfortable in our own bubbles, but we still need to take those other precautions and behaviors until we really see disease decrease in communities.
So I just want to be clear, Dr. Cathy, a medical doctor, when I get a vaccine, I can't then have we've been vaccinated parties where we all kiss and eat out the same bowl and hug and sweat on each other and cough in each other's faces.
Right. I think we were adding one more really, really important tool to our toolbox. And that's going to be key.
Thank you so much. I appreciate it. Just want to be clear that vaccination is not cured from COVID or the capacity to spread.
Well, and we're learning more. I mean, that's the issue. We don't know if vaccine just protects against disease or if it really stops getting infection and the ability to pass it to someone else. But we're learning more. We'll find out more in the next few months.
We'll know more later. That's Ms. Renee, our newest member to the Club of Webinars on Episcopal Relief and Development. Can you talk a little bit about, as a public health official, we know there's not a federal response, but what are you holding as kind of primary things to think about as we've moved through this process?
Well, I think one of the key things is that it's important to recognize that we're at a time where people are becoming extremely concerned now that there are vaccines And there's a lot of anxiety and a lot of behavior. So I kind of want to set the tone where people can kind of have an understanding of where it all came. It did come literally from a federal response. The CDC, Centers for Disease Control and Prevention, along with the National Institutes for Health, specifically asked the National Academy of Sciences and Engineering and Medicine to come up with guidance for the United States in regards to how the vaccines would be rolled out and what it means for the different phases. And so there is a document that's called the Framework of Vaccine for COVID-19 Vaccine Rollout that's really interpreted at every state somewhat differently, but the guidance is very, very clear. The vaccine rollout is based upon the goal of truly decreasing morbidity, which is disease, and mortality, which is death. That is the ultimate goal. And with that said, their goal really was to impact the transmission or duly not have transmission. But it really was also to take away the risk of societal negativity and to address the concerns. And so that framework, there's a summary, but what it did do was really kind of outline the 4 different phases of rolling out the vaccine for the United States. And clearly, there were some areas that were very specific. The first thought was, and I think folks probably even heard it on the news or if you listen to stations stating that the first group was to always try to have our healthcare professionals vaccinated first, our first responders, because they were the ones that are taking care of our sick and frail. And then going on to all different ages if there was comorbidities or underlying conditions. But it was, again, in 4 phases, and some of those phases would break down to A, B, C, or D. The interesting thing is that, and I will take Connecticut as an example, each state can interpret it differently, but Connecticut really did take the framework that's on the national level and interpret it as follows. The first thought was our healthcare professional and first responders, because those are the individuals taking care of us. But because Connecticut really did lose a high percentage of individuals in residential care settings, congregate settings, their process and thought was very specifically that we're going to focus on our nursing home residents and the workers in Connecticut being the second group in the first phase. And Connecticut did very well in doing that. I will tell you that now they're looking now at the third tier, which is the 65, 75 plus year olds. And so it's ongoing. I encourage people on the call that if they do want to know what phase or phases that your state has embraced, to take a look at your state health department dashboard, and that information should definitely be there. One of the key things early on when I was in my role as commissioner is that our administration thought it was extremely key to involve clergy around the state. And we, through the governor's office, and there were different commissioners, myself as public health, the education commissioner, participated for an hour-long type of conference calls initially for any and all clergy. Now you can imagine the number, right? So we would have several different types of these calls, but to really answer questions that they had and talk to them about the importance of their role. And at that time, it was early on, and many of our clergy in the state of Connecticut really did have their own concerns, but really understood their role to be extremely key in regards to communication and being a trusted, respected voice in their various communities throughout the state. And our administration capitalized on that and still do to this day. And it's worked out very well. At the same time, there is the thought that if we can continue utilizing these respected voices, that now we need to talk about having them educated to communicate the respective means of the vaccines, contact tracing, testing, and what it all means. And various clergy throughout the state have taken leads to do such and continue to stay in constant communication with our State Department of Public Health, as well as our governors and administration. With all of that work, I will tell you there's still some challenges that folks have fallen through the cracks. And a lot of times clergy, my pastor as well, have talked about that. I have a colleague and friend here in Connecticut who's over a large, it's like 600 churches that are participants. And the interesting thing is that we're still working right now with the fact that there's the vaccine rollout, that unfortunately there's individuals that are falling through the cracks that are the 75 plus that don't have computers, that may have a cell phone, but doesn't necessarily know how to use it in an elaborate way that they could. And have talked about when they've called this main number that's been shared at the state level, that it's always busy or they can't get an appointment. And there has been a little bit of the public hysteria, if you will. And that has really lent itself again to the role of our clergy in working with their congregation and their families, extended families, and getting the information out and rolling it out. And so we're still working on that. And it's somewhat of a challenge because you still have groups of people that just don't have, again, the equipment, so to speak. And so the use of community health workers within the state, along working out of the church settings, out of where the community health settings, hospital settings, are also very key in all of this as well.
Thank you so much. Actually, I want to bring in a clergy voice here, someone who's been vaccinated. So I'm going to welcome, Michael, can you tell us how did it go? What happened?
Well, I was on the 21st of December. I received a call from the local hospital, Methodist Hospital. I've had a long relationship with the hospital. I serve on a couple of committees with them, and I'm one of the clergy that they use as an on-call chaplain. And they asked if I wanted to receive the vaccine, and I said yes. And so I was basically, because I'm adjunct staff, I have a identification badge from the hospital, and so that's how I was called to get the vaccine. So I received the vaccine, but as I was approaching the hospital, thinking about several things, one of which was, where do I fit in this bigger picture? And one piece is that receiving the vaccine would enable me for better service. Service to the hospital, service to the patients in the hospital, service to the community as well. And then as I was thinking about it as well, I realized that gave me an opportunity to be, for lack of a better word, an evangelist for vaccines. I believe in vaccines for all sorts of things. And I truly believe in the science. I was aware of some of the skepticism that some of my professional colleagues had, but as they were changing their minds and saying that they were scientific skeptics, which means that they can change their minds, that convinced me as well. And so my evangelism work began as I sat down to receive my first dose, because I asked the person administering it to me, I said, have you received it? And she says, well, I'm not sure yet. So I had my very first conversation about why I believe that the vaccine was safe. So I consider myself an evangelist for vaccination. And that's, I think, an important role, as Renee was speaking about the role of the community leaders setting the tone. I think that that's an important piece. And somebody asked me once about how did I feel after the vaccine? And of course, I get asked that now a lot as people are starting. I said, well, I had mild pain in my arm and a sense of giddiness, because it freed me for service. And I think that that's the most important piece. It gives us an ability to do that. I've had a significant number of my congregation who are 65 and older who have received the vaccine now. And again and again, they report slight pain in their arms, sometimes a little bit of fatigue, and a sense of giddiness. And And that really, I think, is a good message for us all to carry forward.
I love sense of giddiness as a as the the feeling afterward. I did talk to my friend who's a nurse, and she said she did sound a little giddy, but not in a giddy that she got the vaccine. She was just under the weather for about 24 hours and then went right back to sounding like her normal self afterward.
And talking to people at the hospital and some of my first responder friends, they're under an incredible amount of stress. We all are, and anxiety, particularly working with the vulnerable and with those at risk. And to have one little piece of that anxiety removed is just, it's a relief.
We saw that in our church. We saw that in our church locally when vaccine became available to 80-plus-year-olds, and we reached out to folks that we knew of that age group and asked, what transportation do you need? What support do you need? What questions do you have? I think churches can play such a critical role in this arena.
Speaking of that, maybe Renee or Cathy, you're unmuted, want to just say, what do you think church people should, like, we got church folks on the line now. What do they need to go do? So it looks like Renee unmuted, and then we'll go back to Cathy.
I think if anything, if you have questions, because you need to be comfortable with the information, you need to understand it well yourself. And the more people talk about this, you know, there are people that are on the fence and have questions and concerns, and sometimes because they do, there's that anxiousness. I think it's so key in public health to always educate and talk about it and get everything out on the table. So there's an opportunity there to do that, and with other clergy and with members, and sometimes just, as we all have probably experienced, even having church meetings just to talk about it. And I say church meetings nowadays, Zoom in its own regard, but at the same time, getting it out there for discussion, because it amazes me to this day how many people still have a lot of confusion or just don't understand what it all means.
Cathy, did you have something to add?
I would echo that. I think you've got health professionals in your congregations that, you know, can provide information, be a respected, known voice there, be educated, help your parishes be educated. And I think also, most importantly, as churches, we have connections to communities and to groups that we work with every day. Whether it be homeless populations or food shelters or shelters or food security or folks with mental illness and substance use disorder. We have lots of connections within communities, and we can be trusted voices in those communities to listen, to find out what information they need, to understand what supports folks need to access vaccine, to feel comfortable with vaccine. So I really think using those connections and relationships that we already have and listening to each other to understand what we can do to support all of ourselves collectively addressing this issue can be really key.
Yeah, Michael, do you want to just add, kind of particularly speaking about access to the church building as we move forward? We're entering our second Lenten season with not being able to kind of gather the way we would want to gather. So, and also that maybe post, when everyone is vaccinated and we have herd immunity and we can have some kind of normal, that it won't be the same, it won't be 2018 or 2019. Can you speak to that a little bit? Sure.
I think that one of the things that we all need to be considering is that return to normal will not be what it was like, Easter of 2019. It's not going to be the same, but we will get to some new normal, and that'll be refreshing and liberating. But one of the things too that I want to emphasize is that a characteristic of return to normal is not a return necessarily to worship. It's also a return to mission. And we can be using our buildings now, even now, for mission. So, for example, we're using one of our parish properties as a testing site in conjunction with our school, and it's open to the whole community. Next month in March, we're having a blood drive in our parish hall because we can do that safely. We were a polling center in November because our parish hall is set up to be able to be used as a public space under very tight conditions. So, what we're hearing is that, and of course, I live in Southern California, so it makes it a lot easier for me to say this, but we're going to be worshiping outside for the foreseeable future. Even though we can go back in our buildings, that doesn't necessarily mean we should. So until it's really safe and we get the best advice, we need to be thinking creatively and differently out of the box. So today we mailed out little packets of ashes with a do-it-yourself Ash Wednesday liturgy. I'm hearing about congregations that are doing virtual pancake suppers, and all the different things that we love. We just have to be creative and think out of our box about that. But it's all about keeping our congregations safe. It's keeping people safe. I do also want to say that we're really giving serious thought to what it means to be reopening our buildings to 12-step movements. We want folks that are at risk to be able to meet, but the 12-step groups that meet at our church have been doing it on Zoom. They've adapted pretty well, but again, I live in a community that has technological access more easily than others. So for communities that are in areas that have higher vulnerability, it's going to be very important to think through how we reach out to our neighbors. So
yeah, I wanted to just quickly respond to Kate Dolan in the chat that yes, he was saying, Michael was talking about returning to a new normal. It's a disaster recovery term. It's this idea that recovering from a disaster is not going to end you back up in the same place you were before the trauma, right? Once we have been changed by something, we can never be the same. There's some good theology about that. I'm taking a Bible trauma class that says all kinds of things about that. But it doesn't mean that we can't figure out safe ways to do mission. And Laura, I think you were going to add some thoughts there, but.
No, I was just going to ask Michael, one of the things that you mentioned early on was folks are really tired. People have been in crisis mode for a year, like a year. Right. And there's finally this piece of hope. And Cathy and Renee, if you have other comments, please feel free to jump in. But like with that release on the horizon, are there some things that congregation leaders in particular should be looking forward to in terms of that shift in energy, moving out of crisis into something different?
Sure. I think one of the things that's important for us to keep in mind is that we know that virtual will always be a part of our future. We've learned that that's been liberating, because I have former parishioners who have been worshiping with us now for the past year, from New York City to South Carolina to Northern California to Spokane. So it has enlarged our vision of what the body of Christ can look like. Even if we're thinking locally, we can still think big too. So that's pretty exciting and wonderful. But theologically, the other piece that is important is that the church always changes, and we've been changing for hundreds and hundreds of years, and this is I'm told that the Chinese character for crisis has in fact two ideograms. One is danger, and the other is opportunity. And so while we are in crisis, yes, we have to be cognizant of the danger, but we also have to live into the opportunity. And that, I think, is a hopeful piece. And we will get to a new normal. It will be different. I think instead of holy water stoops necessarily, we'll have hand sanitizer stations. And I suspect we're going to be in masks for quite a while. But we will be able to sing again someday soon, hopefully.
I think as odd a time as it is, Michael really reminds us that this is normal and that these things happen, and that we do come through them. I remember after a terrible hurricane, an interview on the television with the biologist who was going out to the beach for the first time. And the reporter asked them, what do you expect to see? Thinking about all the destruction that he was going to anticipate. And the biologist said, I expect to see a new beach. And so I think we will see a new sense of community, and new ways that we interact, and new ways that we move forward. There are new ways of being church. We've been talking for a long time about church without the walls, and being more integrated into communities. The opportunities for really asset-based development as a neighbor and a partner in our communities. And I think that's going to be a critical piece as we move forward. We will get through the health aspects of this long before we get through many of the other impacts of this event. So, we have a high percent of our population around the country that has a lot of economic instability and was on the edge to start with. And this is actually exacerbated, or issues of food insecurity, other aspects that we can really serve both as partners in joining people hand in hand to address those issues more on a societal basis, policy changes, advocacy, partnership and community development, more than even just our service role. There's service too, but there's really partnership with, and in terms of really meaningfully addressing these. Those are roles that we as churches can play and continue to strengthen our ability to do so. And I think we've got new tools in the toolbox now that we can plan forward for that. So I think there's real opportunity.
Yeah, I love I think it was Renee that was talking about the getting access for 75-plus-year-olds, for example, to the same calling chain that you used at the beginning of COVID to spread the word about when church was going to be now, or any of those resources is a great tool to kind of pull out again to talk about getting vaccines or other access to healthcare issues that might be arising. Renee, did you want to jump in on?
I do. I just want to, echo in tandem with Michael and Cathy that, it's the physical and the emotional, mental health part that really lends people to really look for the spirituality aspect of their lives. What we're coming upon are people that have been ill, that have recovered. There are people that have been ill that are considered those long haulers that still have the after effects of having COVID and haven't gone back to their normal physically. And then there's those who emotionally have been isolated and haven't had that socialization. Those who have lost loved ones and could not even really say goodbye in the way that we, as our society, is used to saying goodbye. And not being there at the end of losing friends and family. And so they are saying that the new norm is that there's going to need and be a lot more of people's spirituality and reflection, a lot of people that are mental health therapists, counselors, more so than ever, to allow people for this last year to release all that they've been through, and then start afresh if they can. And the other thing, again, to even build on what Cathy is saying, is that with that public health piece, again, clergy are such well-respected voices in the communities, as well as with government. And this is the time to look at the bigger picture and say, what have we learned from this? And in going forward, because there will be another pandemic or epidemic, right? So what can we have learned from this? And one of the key things is to come together. Public health is always about collaboration, partnership, and making it very clear to our local, our state, and federal government that this is the time now to learn from what our mistakes, making sure that there is enough money put aside at the federal level going forward so that when and if and I say when, another epidemic or pandemic occurs, there's money aside to allow states to have the PPE, to have the masks, whatever it's needed, the funding to do what the things that they do. So this is now the time to start that self-reflection, but it's very key. The church more than ever is really a key instrument in addressing people for this last year that their lives have been turned upside down.
Yeah, what I hear you all saying is kind of a multifold approach to thinking about the role of church. There's some advocacy space, so asking for the right laws, the right help, the ways in which we can connect with vulnerable groups and communities that we might already be in relationship with and supporting them because their needs have been exacerbated. A lot of those moratoriums on evictions are coming to an end. So there might be some folks who need to figure out where they're going to live. And so there's a role for church there, but then there's also kind of this communal mourning space. How do we offer communal mourning space for us to hold the sadness that has been 2020? I know some very strong people in my life who are not doing well. And so how do we hold space for even those clergy who have been on the front lines and those church leaders who have been carrying some of that mourning space for others? Maybe those who have been resting can carry those who have been working hard, and just trying to think about those multiple ways to hold people. Cathy, I wanted to offer you that. And then actually, can I ask you a question before you say your thought? One of the questions in the Q&A was about why do you think that West Virginia did so well? So you can say your comment, and then if you can answer that question.
Okay. First, just a comment, because I think it's so important to talk about that holding folks where they've been and the trauma that we've been through, and that safe space to process that. And I also think it's critical that we celebrate what we've uncovered. There are gifts and assets and skills that we didn't know we had as communities, as churches, as individuals. And I think those are important to celebrate and to think of how we can use them in a new world. So I think there's that balance there. So in terms of West Virginia and vaccination, it's probably multifold, and I hope it sustains. I think there's several things. One that we have done in terms of our emergency preparedness and response, that is an area that around the nation, but especially also in West Virginia, people really have done a lot of preparation and practice around vaccination and immunization in large scale. And so that is probably the one area where we've done more than the other in some ways. And so that's to a credit to the national support for that and funding for that and the work of local communities and building partnerships needed to do that. I also think that we, so there's the preparedness piece, but then there's also, we are a state that has focused on vaccination and immunization. We are one of two states that have no exemptions in terms of religious and philosophical exemptions. And so we've had a lot of dialogue and discussion about the role of vaccines and a lot of public communications around that issue. The third area, and I think we laid the groundwork for this based on our experience for H1N1, is early on we said we've got to understand what folks are thinking about vaccine, and did focus groups and some studies to we change messages. And then fourth, we're smaller in some ways. And so it's easier, I think, to do more centralized systems. We did have a coordinated approach through the Joint Interagency Task Force, and we were able recently to put in place a single registration system that's available for anyone across the state. So it's not calling 17 places. It took us a while to get there, but we got that implemented pretty quickly. So folks are working hard. I do think that we have to keep in mind this balance between speed and efficacy and equity. Because there are populations that fall through the cracks quickly and easily. And so this balance is really, really critical. And so I think some of the areas that have been a little slower have really actually been because they've really been trying to focus on the equity piece and reaching all populations more fully. So that is an important tension to make sure that we really pay attention to and track closely.
Yeah, can we talk a little bit more about that equity piece? I saw you unmute. I'll just
Yes.
let it go.
Yes, I actually want to speak about that because it's become such a big issue. So a couple of things. One is the booklet that I mentioned at the federal level, that's about the framework of the COVID vaccine allocation plan, does have the theme of equity really threaded throughout their recommendations about the different phases. So if you do have, again, the first phase 1A with being our healthcare workers, again, putting emphasis on communication with our Black and Brown communities. Now, I know you all, every single one of you probably have heard that, you know, the statistics show that African Americans in general are least likely to get vaccinated, and even though they have been the higher rates of death throughout the country. And so there's many reasons why, and the theme is mistrust, distrust, lack of trust. And so what it has been many conversations that have taken place. I was just interviewed the other day by a local newspaper. What is it? And I said, yes, it is the theme of how we, you know, Africans were brought to this country. It's the theme of the, again, if I hear it again, I think I'll scream, but the Tuskegee syphilis, it's the Henrietta Lacks, it's the existing treatment of some people saying the myths and beliefs by medical practitioners regarding African Americans can really you know, can experience more pain. And so a lot of things that are out there, it's all about the structural racism. And I do believe until this country, in which this is the time that it's come about, the reckoning, so to speak, until the country really recognizes and acknowledges that there is racism, then we won't begin to heal and be able to address this on a larger scale, right? Overall, because as you all know, Black and Brown communities, underserved communities have always been disproportionately represented. So with that said, we are now here at, you know, the COVID-19 crisis pandemic. And what we see is not something, if you're in public health, that you're surprised by. You know, they've always had the highest numbers of, you know, disproportionate rates in terms of chronic disease and illness. So here we are yet again, highest death rates, but not willing to take the vaccine. And what it comes down to, and it seems to be my theme on this call, is that in the African American community, clergy, people of the church are highly respected, and they set the example and they have the most influence. So if you have people in your church that are questioning and they see that their pastor and their clergy have maybe taken the vaccine and even has shared what it was like, that goes a very, very long way in the African American community. But it still is a segment of what's going on for the larger picture. But if we need to get folks, and we do, in regards to the vaccine acceptance and understanding, the clergy are the key within the African American community, along with other respected leaders as activists. A lot of conversation goes on at barbershops and hair salons and things like that, but clergy are at the top of that list within that community.
The other big one I've been hearing about is pharmacists. So your local pharmacist, if you have relationships with them and they know all the elders who come in for their prescription,
that's true.
Tapping into those people are a big resource. The other thing I just wanted to clarify is just there's kind of the no vaccine community. We don't believe in it. There's the like, I don't know about this science community, which I think is probably the majority of the middle. And then there's the I can't wait to get the vaccine. There's also people who just have like documentation issues. So they may not have documents because of immigration status, but also because they just don't have documents. Depending on where you live in the country, it's hard to access those things. Where do you think we should be focusing our energy? I have an answer, but I just wanted to throw that to panelists before we close out.
Well, you know, the undocumented community here in Los Angeles is fairly substantial, but the experience so far has been that the clinics that serve that community is a starting place for them. And there is no evidence whatsoever of any sort of cross communication between public health, vaccinations, and the immigration folks. La Migra is not a part of this equation. So that just needs to be said over and over and over again. And that's the case as well in any disaster that I've ever worked on. So immigration stuff is secondary to public health, public safety.
And the only other thing I will add is just like, let's spend our energy, remember our asset-based approach, like let's spend our energy with those people who want to have access and can't get it, right? Like maybe we start there. So if there's some folks in your congregation who can't get an appointment, don't have internet, can't get a ride, that what are some safe ways that you can set up systems there? Then we move to the education people, the folks that need that kind of input or support. It looks like Cathy's internet went out a little bit, but she'll be back with us. Kind of that middle ground space, and spend less energy trying to convert people that maybe aren't ready to be converted or engage at a higher level. I find that sometimes that burns out our energy, and we are a tired people already. So let's stick with where our energy can be responsive and helpful. We have 5 minutes, so I just wanted to end here and allow everyone to add either a final thought, but particularly, where are you finding your strength as we enter this time of remember you are dust and to dust you shall return, kind of engaging our mortality, the end of time, all the things, right? Big questions in Lent. How you doing and how you getting through it?
So I've discovered a couple of things over the last several months, one of which is the role of music in my life. And so I have one of those Alexas in every place that I work or I rest, so that I can listen to music whenever I want and easily. And then this is most bizarre. So I've discovered a novel series that I've known about for decades, but I haven't ever engaged it. And it's about life in the Middle Ages. And, life in the Middle Ages was a whole lot harder than our life now. And just keeping that sort of in mind is it keeps some perspective. And then Netflix and, Hulu and all that stuff. It's basic stuff.
Awesome. Thank you, Renee. Cathy, just so that you know, we're talking about how we get through these difficult times. Miss Renee, please.
Yeah. So it's been a journey for me for the past year. And what I find works for me is the moment that I open my eyes, I do not reach for my phone. It was a routine. We all do it, right? And they talk about better ways in which you enrich your life. Don't start with your cell phone. But what I do is start with prayer, Psalms 30, and it's become my mantra. And I say it out loud, and I reflect, and I exercise. I try to drink a lot of water. I try to eat healthier. Because there's been this whole, what do we want to call it? COVID-19 bulge, tire, I don't know what you want to call it. But I find that if I do it early in the morning, it sets the tone for my day. And then right at night, that it varies about how well I sleep. I thank God for just allowing me to get through that day before I close my eyes and struggle with trying to stay asleep for at least 6 or 7 hours. But that's been my theme. When the weather gets better here in Connecticut, because we have much snow, going for just a walk with your headphones on and taking in life, it is just very, very calming, very, very calming.
Cathy, how are you getting through?
Thanks. Sorry, we had a power outage here with the storm. So I disconnected. I'm on the phone now. I echo what I was able to hear of Renee and others. And I do think life is a balance, and we've got to kind of. I've done everything from the sublime to the ridiculous. So I have signed up to take a class on contemplation and wisdom path in Christianity, and kind of understand those aspects of things and deepen that ability to do reflection and spirituality with things. Because I do find that it's so rejuvenating with that, to learn new and think together collectively with others and reflect on where we are and grow that spiritual side of ourselves. to nature. And to me, that's a very spiritual experience, being out in nature, where I can do that. Family, and then just fun, crazy things. As you know, Tamara, as we were speaking the other day, I've learned about worm composting, and I have 1,000 worms in my sunroom that are growing, and nurturing and seeing that thrive and playing with a new arena. I think all can be helpful to sustaining us and being who we are in these events.
Thank you so much, Cathy. My big one is you have to stand outside once a day and breathe in air. And if you can't get outside, open the window, stick your head out, and breathe in outside air.
I want to add one other piece too, is being connected to colleague groups. I have a clergy support group that I've been a part of for 35 years. We meet every month, once per all day on Mondays. And that sustained me through a lot of things, including this. We meet by Zoom now instead of in person. And I have other colleague groups, our Partners in Response and Resilience meet. So being connected, and even though it's not the same as being in person, just staying connected.
Thank you so much. Thanks, Michael. That's perfect. And that's where we'll end, because connection is a great place to end. I want to thank our panelists. I want to thank Zinzotle for their work. And I just thank you all for being with us. The recording will be delivered afterward with any resources that we can provide. Thank you so much for your time, and have a blessed day. Go in peace to love and serve the Lord. Thank you, panelists. Talk to you soon.